Hi guys, Dr. Stuart here. A patient recently asked me what are my quick go-to tips for when you've got a sore knee. And I want to show you my two favorite right now. All right, so we're talking about my two favorite tips for helping settle out a bit of a sore knee. So number one is just a bit of old school classic quad stretching. So, if we think about the knee with your patella, your quad is going to run down from your hip and attach over your patella to the other side of the knee. So it can get really nice and tight and jarred and gnarly. So I love telling people, just first off, get in there and get a little bit of love in your quad. Get that old classic quad stretch happening when you're pulling that through. Nothing simple, nothing fancy, just get in there and release your quad. But my other favorite one is doing a little bit of trigger point work on the popliteus, which is at the back of your knee. He sits right in the back here. So popliteus is involved in something we call the screw home mechanism. So when you're bending your knee, as you'll see in this animation, you bend your knee, you don't just straight up bend it. There's a little bit here where your knee locks in and your popliteus is involved in that. But I commonly find in the clinic that he's always really tight. I found this with myself personally with my ACL. I find this with my ACL patients, my knee arthritis patients. They're always tight and sore in the back here. He seems to always get a little bit angry and grumbly when there's some knee pain. So how do you work on that? What you can do is just have a bent knee, take your thumb and find that little guy. He runs on a diagonal from the inside of your knee to the outside of your knee. Just get in on him there and give it a bit of a hold. You can give it a bit of a wiggle, but I find that holding that for 30 to 60 seconds, a couple of different times, help make things so much looser. So give that a go and shout out in the comments below if that helped. See you next time.